Good afternoon to you all and a warm welcome to this Mobile Heights Toppenkväll on Reinventing Healthcare with AI. Today the event is being filmed from Studio Meeting Point by Altitude Meetings in Malmö. And soon you will hear from our two great speakers from Lund University and from CICADA HEALTH by Considera Health. We are really happy to see so many of you have chosen to join us here this afternoon, and actually we are around 110 people who have registered for today's event. Actually, it would have been very nice to have you all here, but because of the circumstances, we cannot meet here. Otherwise, we would have loved to have you here to mingle with each other. But I can tell you that among you, there is a great mix of people behind the screens. We have people here from big companies like Sony, Ericsson, Telia, and Volvo Cars. We have people here from smaller companies like LiveFinder, Vevio, and Cross Solutions, and of course also from the academia, Lund University and Halmstad University. Hi, very welcome. And from the public sector, Region Skåne and City of Malmö, City of Helsingborg. It's really great to have you all here. My name is Molly Lofquist and I am the Head of Communications at Mobile Heights. And with me here at the studio today, I have my Mobile Heights colleagues Ola Svedin, our CEO, and Malin Larsson, who also works for AI Sweden. And you will meet them both soon. And then I know that the rest of the great Mobile Heights team is watching, all 10 of them, and you are following us online. Hi, and thank you for your support. Before we start, I would just like to mention our next upcoming event, which you, of course, do not want to miss. It's November 4th, and it's the Innovation Summit on Waste Identification. Very sexy, right? No, not really, but okay. If I add some other topics like sensors, image analysis, object identification, and AI for a circular economy, it makes it even more interesting, right? So if you want to join us there, just go to our website, mobileheights.org, and you will find the information and the possibility to register. It is organized not by us, but by Material Business Center at Innovation Skåne and is supported by us at Mobile Heights. So remember, November 4th at 9 to 11. If you want to know everything that is happening at Mobile Heights, just keep track of everything on our website, or even better, we make daily updates in our social media channels. You can use whatever you like best, if it's Facebook, LinkedIn, or Twitter, doesn't matter. And now just two practicalities. The first one, you have the possibility to ask questions during each speech in the chat. So please use that opportunity. And to make life easier for me as a moderator, just write them very short and in English. Right, and the second thing is that today's Toppenkväll, of course, will be filmed and available online afterwards. So for those of you who like this event so much, you want to watch it over and over again, you have the possibility. We will make sure to upload it on our social media channels. Now let's have a quick look at the agenda of today. And first of all, we will listen to Ola Svedin from Mobile Heights, who will give us a quick update of what's happening at Mobile Heights. And he will also present AI Sweden and Malin Larsson. Then our first main speaker is Sonja Aits from Lund University, who will talk about all the AI initiatives at Lund University. Our second speaker is Helena Linge from CICADA HEALTH by Considera Health, and she will tell us all about how digital and AI approaches can assist follow-up care of childhood cancer survivors. Very interesting subject. We will end with a short wrap-up, and at 4:30 we will end all of this Toppenkväll. Right, so with that, I would like to introduce to you, not to myself, our CEO of Mobile Heights, Ola Svedin.
Thank you, Molly, thank you. And by the way, waste identification can be a really hot topic.
You think so?
So don't miss it.
Okay, yes. It's November 4th.
Okay, great. I know you're out there. It's really strange to not see you all, but I know we're a big family, and I know there are about 100 of you as members out there. So I wanted to take the opportunity today to talk about a few initiatives that we are driving at Mobile Heights. And the first one is about digitalization in general when it comes to smart city and manufacturing industry. And here you as member can engage. We have just started a big initiative called DigitHub, where you as members of the cluster have the possibility to engage and participate in activities to find solutions in the smart city and manufacturing industry. So check it out. Go to digithub.se or contact Alma Sandberg directly at Mobile Heights. That's the first one. The second one I wanted to talk about is about training and skills. And it's actually an opportunity for you to get free training for IT experts. We have just started a project called CoSkill. And CoSkill was created in the wake of the pandemic. So the objective with CoSkill is to provide opportunities for people that are affected by the pandemic. For instance, if you are what in Swedish is called permitterad. So don't miss that opportunity and contact Carolina Garces at Mobile Heights. You have the email address there. You can also find Carolina and Alma on the Mobile Heights homepage, of course. And the third initiative, the third topic I wanted to talk to you about today is AI Sweden. So to that end, I welcome Malin Larsson on stage. Welcome, Malin.
Thank you, Ola.
So AI Sweden, what is that?
AI Sweden, yeah, good question. No, for the one who haven't heard about AI Sweden, and for the one who have heard, it will be a recap. But AI Sweden is a Swedish Center for Applied AI, a national center that is non-profitable and neutral for working with AI. And is supported by the government and the private and public sector. And the mission for this center, for this national center and regional center, is to really find projects and activities to solve challenges within AI, to really strengthen and accelerate the application of AI.
It all sounds really good, Malin, but what can the community here in Skåne, in the cluster, in the tech cluster here in Skåne, what can they do to engage in AI Sweden?
They can in many different ways. All around Sweden, we have regional offices, and here in the south, Mobile Heights is the host organization. So I'm here. Ola is very engaged in the project. And how to engage in this is, of course, come to us and talk to us and to get the information about what is going on, what projects are going on, and what activities is going on, as well as visit the website. There you can see and get a lot of information around the different projects and activities, educations, etc.
So companies and researchers out there can engage, and they should contact you.
Yeah.
To explore the opportunities.
Definitely, and this is the initiative that is not only targeting the very techie organization. This is about how to start your journey, as well as for the one who's very advanced in such researchers, very techie companies as well, to really get the connection in between the stakeholders as well as the experts.
And AI Sweden, the target is all sectors, right? It's different. It's logistics, it's manufacturing, yada yada.
Yeah.
All of that, and of course healthcare. I guess.
Of course, healthcare. And within healthcare, there is a lot of projects going on. And within AI Sweden, and you can also read about this on the website or contact us. And I would like to, so let's dig deeper into the healthcare and AI. So Molly. What is the program for the next?
Today yes, as you said, we're going to dig deeper into AI and healthcare. So thank you very much, Malin and Ola.
Thank you, Molly.
Thank you, Molly.
So with that interesting update, I would like to introduce our first speaker for today. It is Sonja Aits from the Faculty of Medicine at Lund University. And I just want to remind you all that please write your questions in the chat and we will try to respond to as many as possible afterwards. Hi Sonja, how are you?
Hello, I'm good. Let me just test my slideshow. Thank you for having me.
Where are you, Sonja?
I'm actually in the middle of Skåne in my home. To be honest, hiding in my garden shed because my small son is also home.
Where in Skåne is that?
Yes, that's close to Ringsjön.
Oh.
Between Gårdstånga and Hörby in the middle, kind of.
Right. Okay. It's great to have you here, Sonja. The stage is yours.
Yes. So I'm here on behalf of Lund University and also on behalf of AI Lund, which is one of the partner organizations of Mobile Heights and AI Sweden, of course. So AI Lund is an open network for artificial intelligence hosted by Lund University. And we do a lot of seminars, workshops, different types of activities, basically anything that would promote research, innovation, education, and also cooperation with people outside the university. So we have over 1,400 members on our mailing list for now, and these are very diverse. So we can have people from industry, from public sector, but of course also a lot of people from academia, and that's not just from Lund University, but also from other universities close by. We're very interdisciplinary, so we cover everything from AI ethics, for example, to social science, to hardcore AI model development, and so on. And we are also closely connected, of course, to the other local Swedish and European e-science organizations, such as WASP here in Sweden, for example, but also ELIS, for example, on the European level. So you can find us at ai.lu.se, which is the landing page for the platform. And you can already see in the headers that we have everything like we have a list of educations, for example, we have research and news, and we have a lot of events. So we have a full event calendar, and all of our events are open to everyone. So you don't have to be a member of the Lund University or kind of officially affiliated organization. So even members of the general public can attend if they choose to. And one thing that I would also like to highlight is that you can watch past events on AI TV. So you find recordings from many of our seminars and workshops there. And we can also we use this a lot in our teaching activities as well, these videos. We also have a drop-in every second Monday where you can just, show up for either the entire time or part of the time and discuss with other researchers and other people that are interested in AI. Normally we had this as a physical meeting, but of course at the moment it's on Zoom. You can also contact us if you're looking for academic collaborators, if you're trying to find experts, for example, or for consultations or for events. If you simply want to network with the AI community, you can attend our events. We also can point you to the right commissioned education, for example, within AI, which Lund University, of course, provides. And we're also open to other projects, like we have had joint hackathons and citizen science projects, and even joint funding application with external organizations. AI Lund is, of course, not the only organization that promotes artificial intelligence at Lund University. We have actually a rich environment, and we all of us work together kind of with overlapping but mostly complementary activities. Sometimes we also do events together, but I encourage you to check out these different organizations. For example, eHealth at LU is of course very relevant for everyone here today, and they have very interesting seminars very often. And then we have the research networks like Essence, Elite, and WASP, which are covering also other universities in Sweden. And then we have PhD school, which is called Compute, which often has also seminars that are open to others. And we also have something in LINXS, which is connected to Max for ESS. And many of the events actually we put jointly all of these organizations into the compiled calendar, so you can try and look there first so that you don't have to go through all the individual websites. What we've done a lot within AI Lund and Compute is to try and generally try and link up different communities of users with AI developers. So for example, we have an initiative that's linking up AI people with medical and life science researchers, and also students and external organizations. And we do this through joint student projects, courses, and all kinds of other activities as well, in the goal of building a proper community. And in the same way, we also do this with the X-ray and Neutron science community. We sometimes call them the X-ray Neutron people, the people with the problem, and the AI researchers, the people with the solutions, but that's not really fair though. But yeah, we have a next seminar, for example, on November 4 within this initiative, and we'll also have a hackathon on April 12 to 14, which is open to anyone. So I just want to give you some brief research examples, what we have in Lund. So one of them is, for example, from my own group, where we do a lot of knowledge creation and knowledge mining with AI. So as you know, we're currently in a pandemic. And even in this relatively new pandemic, we already have 300,000 research articles to go through. This is, of course, not doable for any human anymore. So we need systems that can automatically extract this kind of knowledge. And in medicine, as you all know, text is not just the only source of knowledge. We have also lots of databases. We have lots of clinical and research data, as Helena will tell you about. And all of these can give you information about patients, about diseases and potential treatments, but it's not easily accessible because it's just a mountain of information and no one can handle it. So for this, we can use artificial intelligence, for example. And here, just an example for text mining. So imagine that you have information scattered over 3 articles, and then the text mining can actually, from this, put a pathway maybe together and highlight potential drug targets. So this is just one of the things you can do with AI in medicine. But of course, depending on what type of text and what type of information, for example, you would put in the context of COVID-19, for example, this could be electronic health records, but even social media posts. Then you can, extract the type of information you want using a targeted pipeline towards this, whether it's adverse effects, for example, or patient symptoms you're looking for. And then you can gain from that different insights that can either guide, for example, policies, but also, R&D activities. Another big topic is, of course, AI for image analysis. We have very, very competent people at the math department, for example, that are engaging in a lot of medical image analysis, together with then partners from the hospital or also from the biomedical center. So my own group, for example, we do microscopy image analysis where we detect objects, for example, on cells, but others do, for example, classification for X-ray from mammographies. There's a big project, for example, and also for histology images, for example, there's several projects at Lund University. The goal, of course, with all of this is to develop AI-based clinical tools that then can support both the diagnosis, but also maybe the outcome prediction and eventually even give therapy suggestions. So there are a number of projects where people look at different information from the medical journals, for example, and then try to build an algorithm that can be a decision support tool. So we have a lot of, for example, in the heart area for matching up organs and patients, we had very successful projects at Lund University. So this is just a small flavor of what we have. We've got, of course, epidemiological and cancer and diabetes projects, analyzing basically any type of data that we have in medicine. So if you're interested, you can just send an email, for example, to me or to anyone else in the AI Lund steering group, and we can try and put you in touch with the right collaborators. You can also come to our events, of course, or you can follow us online and engage with us this way. And that was really all that I had to say right now. And just simply thank you for inviting me. And we also, of course, joined activities with AI Sweden, and we really appreciate this partnership.
So, okay, thank you very much, Sonja, for joining us today. So Do you see any specific possibility for our Mobile Heights members? Can they join AI Lund in some way? I mean, what would be the greatest benefit for them if they would join AI Lund in your projects?
They can, of course, join AI Lund. You do this by registering on the website. It's just a simple online form. It doesn't cost anything. And many of the Mobile Heights members are actually already members. Many of the people that from these organizations, and then you can just find a workshop, find a seminar that interests you, and come and attend. At the moment, all the activities are online, so it's even easier. So just look at the event calendar and then find out if there's something for you, and if not, if you have a great suggestion for a new event, we're always open to that. Also, if you have something cool to present yourself that you think you would want to highlight, our seminars are not just for academics, so this is really an opportunity to showcase what you're doing.
Yes, great. And you also have a newsletter, right? So that one can get invited to all your events. Can we find that on your webpage if we want to register for the newsletter?
Yeah, exactly. So on the webpage, you can find a registration link, and with that registration, you will then automatically be invited to all of the events.
Okay, right. Thank you very much. Good. So thank you very much, Sonja. Great to have you here, and see you next time. And with that, I would like to introduce to you our next speaker, which is Helena Linge. Helena Linge is the CEO and co-founder of CICADA HEALTH by Considera Health. And Helena will tell us about how digital and AI approaches can assist follow-up care of childhood cancer survivors. Welcome, Helena. Hi, Helena.
Molly. Hi, Molly.
How are you today?
I'm doing very well, thank you. And you?
Yes, I'm fine, thank you. It's so great to have you here, and great that you could be here with us in Malmö. We are not so many people here, but it's you and I, and it's Ola and Malin from Mobile Heights, and then we have two more people from Altitude Meetings and two technicians here in the room. So it's at least nice to be a couple of us here. Okay, so the scene is yours, Helena. Looking forward to hearing about your project.
Thank you very much. So thank you for having me. As Molly said, I am Helena Linge. I am the CEO and co-founder of Considera Health. And my training is in medical science, and I also have a position at the university at the Department of Clinical Sciences. So you will see a couple of slides. That was the first one. You will see a couple of slides with different origins, and to clearly state our purposes with the presented work, I'd like to show you this purpose of intent. We wanted to understand and create the largest possible value of already collected data to benefit science, healthcare, and those affected. So pediatric cancer is the single most common cause of death among children between the ages of 0 and 14 in Sweden today. 300 children each year are diagnosed with childhood cancer. And I want you to know that these are not the same types of cancers that affect adults. There are 12 categories of cancers that affect children, and the two most common ones are brain tumors and leukemias. So childhood cancers are treated with a combination of different therapies. This includes chemotherapy, radiation, surgery, and stem cell therapy. And it's through the combination of these that we have been able to achieve one of medical science's largest success stories. And that is the increase of survival from about 20% in the 70s to 80% currently. This has created a large and growing new group of childhood cancer survivors. In Sweden, there are about 11,000. This means that 1 in 700 in society is a childhood cancer survivor. So, being cured for cancer comes with a price, and the price is that about 70 to 90% of these individuals will be affected by something called late effects. That is a side effect created by the treatment that cured them as children. And these side effects can range from a second cancer later in life, heart problems, cognitive impairments, infertility issues, and a long list of other problems that affect these individuals' health. And it's also important to know that the longer a survivor goes on in life, there is an accumulation of the late effects, or at least of the disease burden. And so it's important to reach out to those who were diagnosed early in the 1970s and 80s, because not only do they accumulate with time, but the treatments were also more harsh and created larger late effects than the treatment used today, luckily. So what do the survivors themselves say about the situation? Well, an international advocacy group called the Childhood Cancer International wrote this declaration in 2016, where they clearly state that they want to have follow-up clinics established. They ask for more research in survivor care services, and they also want to have full disclosure and transparency when it comes to their medical history and their potential risks. Someone who was very interested in finding out the future health of his patients was this man, Thomas Wibe, a pediatric oncologist. He spent 12 years procuring the treatment history of all patients diagnosed with pediatric cancer from 1970 until current date in southern Sweden. And it was actually, let me go back. And when I met Thomas and we became friends, it was a bit of a problem to understand where all of this was going. It was a horrific amount of work, and there was a thought that maybe this would all end up on a bookshelf and possibly even forgotten about. So in our becoming friends, Thomas has a passion for details and accuracy, and I was looking for a way to make a difference with my research. Well, together, with the help of a donation from the private sector, we were able to put this registry, which it resulted in, to work for the Late Effects Clinic in Skåne. And there was about 300 variables per patient, and not all of them were valuable for medical follow-up. So we were able to extract the 45 most valuable variables and present this as a structured report, which enabled medical follow-up. This would, in a way, also guide the clinicians in saying something about the future risks of and care of the patient. And we call this ZAP because it's much quicker to go to this application than to actually go to the medical chart of, especially when it comes to the early charts. So through ZAP, we created increased information security, patient safety, and enabled efficient medical follow-up. So now we had done something for one person on the one-person level. And we wanted to do something for the entire group. The available information today is, of course, clinical experience, case reports and studies, and all of this collected evidence has been transformed and synthesized into evidence-based guidelines. Using some of these evidence-based guidelines, meaning we know a lot what happens to this group today. And one of the risks is if you have been treated with radiation to the chest as a young girl as a measure of curing your cancer. Well, these women, when they grow up, they risk a second malignancy, a breast cancer, much earlier than the healthy population. And so this is something that is preventable. And through our risk stratification tool that we developed, we were able to, together with the Late Effects Clinic, contact 48 women who were at risk for developing this early breast cancer. And when we did this, 2 previously known breast cancer cases emerged, but also 3 previously undiagnosed breast cancer cases. And these women could receive proper care. And for this, we were nominated for the Athena Award for Best Clinical Research a few years back. And we also received an award for the best and most compassionate use of data. And although this may not be news to any one of you, let me please, with the following slides, point out to you that the longer a breast cancer is present, the larger the tumor will grow, and also the survival will decrease. And the same goes for costs. Many studies have tried to assess the costs of treating breast cancer at different stages. And what's general for all of these 10 studies in this paper that I present to you here is that the more advanced breast cancers are more expensive to treat. And so we also see a possibility for healthcare to reduce its costs. So with these 2 measures, early detection saves lives and reduces costs, but we also identified that it places demands on having data, and new work processes must be in place, and also a certain degree of leadership. So now we had done something for the individual patient. We had also done something for the group in the registry. Now our ambition was to do something for an even larger group nationally. And to do this, if you're still with me, this is where the AI comes in. So in Sweden, we have a wealth of registries. And through our personal identification numbers, we are able to follow individuals and gather a great deal of information. And we, after ethical approval and other approvals, many legal issues were gone through, we were able to construct a research project where we merged the treatment data with the healthcare data of how these survivors do later in life. And we wanted to use, well, this actually created a data set which was not very large in size, but quite complex. And so we looked to AI for help in analyzing this. Now, AI is a multifaceted term. It can be many things. And most of you have probably heard about neuronal networks. I want you to know that robotics uses AI for self-learning. But there's also the possibility of creating deep fakes. And today, even art and music has been created by AI. And of course, there's always singularity. Now, we didn't use any of these methods. We focused our work on Bayesian statistics and causal analyses. And we received a great deal of attention, positive attention for our attempt. I had the pleasure of being part of Vetenskapens Värld on national television, and they created this film. And I think it very clearly illustrates what we're trying to do. So we have data on the individual person, the patient, the former patient. We have information of the disease and of the treatment and of the late effects later in life. And by testing similarities and differences, we are able to pinpoint certain links that may have been undiscovered before. So the point of this was to determine what parts of the treatment or what combinations of the treatment led to late effects. Is there something we can do once we have identified these to help, for instance, screen or inform the patients or their families that we felt that would make a big difference. And the way we see this is that many things are known about late effects. The most severe ones have been known since the beginning of the combinational treatment era. and clinical experience can answer many of the questions the survivors have. But it's quite possible, but with this new information, we could discover new information, new links, and possibly, if you want to be visionary, possibly even we could change the way the primary cancer in childhood is treated. With the purpose, of course, to limit the development of late effects. So I want to summarize. You've seen images both from research work at Lund University and also from the startup called Considera Health. And we are very proud to present this as our system. It has 3 modules. It's the treatment summary, so for the individual patient, with the features of information security, patient safety, and also a very good basis for medical follow-up. I've also shown you the tool for risk stratification. So many things are known. Let's put that information, this knowledge, to good use and find those persons at risk. We believe we can help save lives and reduce healthcare costs. And on our more AI visionary approach, a tool that enables us to look at follow-up profiles and looking at this information, this data set as a library, it could be a valuable tool for decision support in healthcare. So without these people, none of this would be possible. It's an honor for me to be here today to represent all of these people. Our research partners are Lund University, RISE, Climber, who has an office here in Malmö, and of course, Region Skåne. The research is funded by Barncancerfonden and Vinnova and Crafoordska Stiftelsen. And to the right in the picture, you see the company, the founders. We have support by LU Holding, the university holding company, who's helped us in our progress in commercializing our ideas. And we have received quite a lot of positive attention for this work. And with that, I thank you for your attention.
Thank you very much, Helena. It has been so interesting to listen to you, and I think it's a great project and a great company that you have here. It must be feeling really good to make such an important impact.
Well, it feels very rewarding. Thank you. I hope I can come across with this point, because it's very important and very dear to all of our hearts.
Yes, yes, I understand that. Great. So we do have a question to you, and actually this was a question that was also given to Sonia, and it is what are the social and organizational challenges of all this when it comes to AI implementation in hospitals and in medtech companies? What are the social and organizational challenges? Are there some obstacles there?
Yes, it's a very interesting question, and I have to say we've come a long way since 2015, looking back at old documents and the problems we faced and all the meetings we went to in trying to describe where we wanted to go with this project and this idea. We've been through ethics, we've been through legal, we've been through touching on the organizational part. I think it's necessary for people to change the way they work.
Yes.
With information.
Yes.
And
in which direction do you mean? What do they have to do now that they didn't do before?
Well, data literacy is a very important point.
Yes.
Being able to use data and look at data and also be critical of data.
Yes.
As well as the algorithms that we place on top when we try to create something with AI.
So the human touch is still important.
Of course. And we've been clear on this throughout this whole process also, that it's the clinicians that have the final say on what happens to their patients.
Right.
So we are not making any decisions with our tools. We are aiding healthcare.
Okay, right. So you merely use the data as a help to make the right decisions.
this is how we see it.
Yes, yes. Okay, good. Let me see another question. Could you tell us something more about any other experiences that you have at Considera Health when it comes to thinking in a new way when it comes to healthcare?
Well, besides all the other great companies at LU Holding, I would like to point in the direction of our chairman of the board, who is also a commitment in a company called Encare.
Yes.
So they set out many years ago now to change the way large surgeries are done. Because the time of convalescence after such a big surgery could differ very much.
Right.
And so just collecting data and looking at data and evaluating what steps are important, they were able to shorten the convalescence time from 17 days to 3.
Oh, wow.
And
wow.
that was
That's great.
and that was even if the healthcare provider were to follow their protocol to, I believe, 70%.
Oh, really?
So you don't even have to be perfect to achieve a huge difference.
Wow.
And I think that's a great inspiration.
Really, really, because that, of course, has a great impact both on the person and on the individual from a kind of human point of view, but also on the costs on society, right?
Of course, both to both the healthcare costs, of course, but also absence from work and other things that need to fall into
Cost
place.
for rehabilitation, I suppose.
Exactly,
yes,
exactly.
Yes. Okay, that sounds really, really great.
So using data for prevention and to improve the way we work.
Yes, yes. Okay. And do you have any more initiatives within AI and healthcare that you can tell us about? You mentioned a few of them, treating women breast cancer.
Yes.
Do you have any more examples?
There's a very interesting project also going on at Lund University called AI Lund, which is
AI Lund?
Yes, AI Lund. So it's artificial intelligent use of registries.
Oh. Right.
Looking at a much larger data set than we have, but that will be very interesting to follow.
Yes.
And of course, something that I think many are aware of is that images can be analyzed with AI.
Yes.
And the lady who is Cancer Researcher of the Year, appointed by Cancerfonden, she uses AI to look at mammogram images.
And she's at Lund University.
Yes. Sofia Zachrisson. Yes.
Can you say her name again?
Sofia Zachrisson.
Okay, right. Okay, very, very interesting. Right, I think that is more or less all the questions that we had. So again, I would like to thank you very much, Helena, for joining us. And I also would like to mention usually we do have a physical meeting where everybody can mingle with our speakers after the event. And unfortunately, we do not have that possibility today. But I do hope that you all take the possibility to contact our speakers if you would like to connect and discuss like further cooperation.
Absolutely. Very interesting.
Yes. And if you do not find the contact details to Helena and to Sonia at AI Lund, you can just contact me. It's molly@mobileheights.org or info@mobileheights.org. And we will be more than happy to connect you, of course, to the speakers of this event today.
That's great.
Okay.
Thank you.
So thank you very much, Helena.
Thank you for having me.
Right, great. So with that, we would like to make a final wrap-up of the day. And to help me with that, I am calling Ola Svedin, or again, our CEO. So what a great afternoon, wasn't it?
Yes, and I picked up a few things from our speakers that I would like to mention that I thought were very interesting. First of all, what Sonia told us about all the activities at Lund University, and I heard her make a call out to the whole cluster here to engage with Lund University. And as Sonia mentioned, I mean, she's part of the team leading AI Lund, but there are also other work groups within Lund University. So don't miss that opportunity to engage with Lund University.
Yes.
Another thing that I picked up, I think Sonia mentioned it a little bit, but Helena, Helena told us about it as well, and that's the ethical aspects a little bit of the use of AI.
Yes.
And sometimes we read in the papers, we see in media, the AI is taking over. they are making the decisions, etc.
Yes.
But that is not the case, and I think that's very important to point out. When you talk to the specialist, the people actually using these tools, they are using these just as tools.
Yes, it depends on how you use the data,
Exactly.
right?
They're not making the decision for the clinicians, the physicians, or whoever is in charge of the decision, but it's a tool to aid them in their decision.
Right.
And I think that's a very important thing to think about. And also very interesting what Helena presented was that they started with a quite small data set, and they could draw conclusions. I think Helena said they found 3 patients that had previously unknown cancer, and that's like wow, and that you can do that even with a quite small data set, and that they were able to expand the methodology that they had developed to national level.
Yes.
So all very, very promising, and of course this is just the beginning of all of this.
Definitely
we
just
can
the beginning.
we can apply AI in all aspects of society in a responsible way.
Yes, yes.
That's my takeaway from the 2 speakers today.
Yes, yes, very interesting. Thank you very much, Ola. And with that, I suppose, so folks, I suppose that was all for today. And with that, I would like to finish by giving a big thanks to our great speakers, Sonja Aits from Lund University and Helena Linge from CICADA HEALTH Considera, and to all of you, of course, in the audience. And last but not least, I would like to give a big thanks to the crew here from Altitude Meetings at Studio Meeting Point in Malmö, and also to the technicians from June. So thank you all very much for attending, and see you next time. Bye-bye.
Bye-bye. Missing not seeing you here in person, but bye-bye and thanks for now.
Yes, we're really looking forward to seeing you in person soon again. Bye-bye.
Bye.